The public housing resident population in New York City is very important for a number of reasons. It's large, nearly 500,000 people live in public housing, predominantly low income, more than half are living below federal poverty level. And so if you want to work in health disparities, this is not only an opportunity, but a responsibility to do so. The adults living in public housing are aging more rapidly than New York City adults, in part because they don't move to Florida when they retire, they don't move into assisted living, they age in place. The overarching profile is one of high rates of chronic conditions, multiple chronic conditions, functional limitations, so not able to conduct the activities of daily living by themselves, and high rates of smoking and physical inactivity. Within public housing, there's a gradient of income. We have very low income public housing residents, and then we have ones that have more resources. And the ones that are very low income look similar to very low income residents outside of public housing. It's not a public housing issue per se, it's an issue of poverty. What we're trying to do is characterize this and understand where are older adults living in public housing, how many of them are living in senior appropriate buildings and apartments, what's the future look like, how can we start to reshape public housing to be more age friendly, and harness the engagement of older residents, younger residents, just the public housing community to address the health and quality of life of older residents. But we conducted what we call a simple random sample survey, so a representative survey of older adults. And we've been using that survey to characterize their health, and then together with multiple city agencies, come out with a report on recommendations and action steps. We spent half a year designing the survey. We spent a good amount of time analyzing the results, half a year to a year, but the bulk of our time has been really grappling with the so what and really working with the different spheres and communities that are engaged in service delivery or speaking on behalf of the public housing residents. One of the best things about coming to the CUNY School of Public Health at Hunter College is that it is interdisciplinary and it's committed to community engagement, and that means New York City engagement here. And I think much of the work that we can do in New York City can be a model for cities and urban settings elsewhere. CUNY has a fantastic array of faculty who have had both public health practice experience and research. So we speak both languages. I think we're very eager collectively to work with the city in public health governance and to support New York City. I think the focus on interdisciplinary work allows us to work as a team as opposed to in a relay race handing off the baton to each other. So we can characterize problems, we can think together about the solutions, we can implement those solutions and evaluate them.